This year marks the 50th anniversary of the Older Americans Act. Not the most famous anniversary, but this law became the major vehicle for delivering nutrition and social services to America's elderly. The anniversary comes at a time when we are experiencing the largest influx of people over 60 in our nation's history. To talk about the act and what it's done and whether these programs are starting to fray at the edges given the growth of the senior population, we have Gary Olmd, who is the president and CEO of the Northwest Indiana Community Action Corporation. Gary, welcome to the show.
Thank you, Steve. Glad to be here.
All right, so just to start off, this
Sure.
act, it's not Medicare, it's not
No.
Medicaid, it's not Social Security, but so describe what the Older Americans Act does.
Well, the Act establishes the foundation and the structure for the delivery of services to the aged population as well as disabled Americans. You mentioned a couple of the services, but it provides the structure and then the authorization for the federal government to direct funding to the states and then to local communities like here to support a variety of services
Right, so
for the elderly.
Yeah, so but I don't think this act is particularly famous, but there are a lot of famous programs. In fact, Meals on Wheels.
Right.
This is where that comes out of there. A lot of the home health care things to try to keep people out of nursing homes. All of that was under this.
Yeah, it provides the vehicle, and in Indiana it comes via the federal government to the Indiana State Division of Aging, part of Family and Social Service Administration. And then this act also establishes the network of providers, and we as the Area Agency on Aging for 6 counties in northwest Indiana are the local administrator and service provider for a whole host of services. You mentioned Meals on Wheels, caregiver support, transportation support services, which, as we know, in northwest Indiana is of a tremendous need that is very, very underserved. And just those everyday services that allow people who are in need to be able to live in their homes with dignity and to have the kind of supports. It could be nursing supports, homemaker, whole host of services. Without the passage of this act and without the structure and foundation to direct the funding, these services would not be available locally and or nationwide.
So we had somebody who is the executive director for the Council on Aging nationwide,
Right.
the groups that the umbrella group for organizations like yours.
Yep.
And they were saying that it's been 4 years since Congress has reauthorized this act. So they're hoping that this is going to be reauthorized soon. Do you have any hope that this?
Well, I do. You know, there's moments in time and events that kind of maybe provide the type of incentive that is necessary. The 50th anniversary of this and many other very important federal acts that Lyndon Johnson signed into law in 1965, be it the Civil Rights Act, be it the establishment of the Community Action Network, and in particular here the Older American Act. I just listened to the Senate committee hearing on this, and it received unanimous support and recommendation from the committee, and it's a matter of it getting to the floor. And what this enables us as providers to be responsive to the needs now, not the needs of 4 and 5 and 10 years ago, because our senior population is changing. And you mentioned the influx. We're at the halfway point also of between the year 2000 and 2030, the number of Americans aged 60 and plus will double. So we're halfway there.
It's
Now,
already the largest senior population in the nation's history, and it's going to get much larger.
right. And in that time period, for it to double, if you're not keeping up with the resources necessary to meet changing needs for an exploding population, the cost of that will be much greater than what would be required to fund the services.
Because a lot of these things are just basically designed so people can stay in their homes longer. You know, maybe they need a meal delivered to them.
That's
Maybe
right.
they need a little housekeeping to keep folks out of nursing homes, because once they get into nursing homes, well, that care becomes dramatically more expensive.
Well, it's where it should be a nonpartisan issue, because it plays on
keeping
both,
old people out of nursing homes should be nonpartisan.
because one, it's what 98% of the people you talk to who are above 60 want to stay in their home. Secondly, it is nearly 8 times less expensive to provide these kind of supports in homes. So if you're in a private sector market and you've got demand at that level and you've got cost savings at that level, that's a win-win for all concerned.
All right, but that's at the national level,
That's
and that's
right.
the federal money. How are we
bet.
doing at the state level here? We've got a General Assembly, and they're working on a 2-year budget right now.
Right. The key parts there is, one, there's match requirements, so that as the federal funding is appropriated, there's a match requirement by the state. In Indiana, it's Older Hoosiers funding is what it's called. So as that would increase at the federal level, hopefully, then the requirement that the state would meet would also increase, so there'd be a greater investment. The other is the choice funding, which is the specific state funding which enables people to stay in their homes. It is simply to keep people out of institutions. It's to provide those supports.
Yeah.
That money has stayed flat over the past number of years, and it's unfortunate, having been in this type of work for 40 years. The wins now are when your funding stays stable, not when it increases.
Okay, but the funding is staying stable, but the
Right.
population's going up. So I'm thinking somewhere in there is a waiting list. How are the waiting lists?
Yeah, the waiting lists are ever increasing for all our services, and you can just go down the road, whether it's meals, whether it's caregiver support. There's simply not enough money. The number of individuals who have to take care of a loved one and their families and work, the supports they need are not being funded at an adequate level. So what you have is a huge gap. In the private sector, the market would respond. When you're dependent on the public sector for the funds, then it requires our elected officials at a state and federal level.
Can you quantify how large the waiting lists are in Northwest Indiana? And what's happening with those people who are on those waiting lists?
I can't talk any number of programs that we have. I can't speak to the specific numbers, but what happens is one of a couple things. People go without, or they look to family or friends, their community to provide to try to provide the gap in service. But all in all, it means that people go without necessary services, or the only choice is then they become institutionalized. They lose their home. They go into a nursing home. We pick up a much larger tab as taxpayers, and it's one that just simply doesn't make sense.
So once people become indigent, then the state does kick in and then provide, but it's much more expensive.
You want to pay at the preventative level, or you want to pay after the fact? After the fact is always much more expensive.
So what were things like 50 years ago, when this act passed?
Well, as far as when it passed, it was like what it spoke to was a commitment that we as a nation are responsible for each other, and that there is a public role for the health and welfare of our citizens, and that not everyone has the means to take care of themselves, nor can everyone predict, whether you have means or not, a life-changing situation that completely alters your ability to take care of yourself. And at that point in time, I mean, when you look at 1965, you know what this nation was going through. And it was a response by Johnson and the Great Society and the number of acts that he established as law to say we're responsible for each other. And that remains, and it's a commitment that we ought not walk away from, and one that should be invested at a greater sense. It's all about choices. It's all about priorities. We have plenty of revenue in the country, not to do everything we want, but then it's a matter of the choices we make to do what's most important. From where I sit as CEO of the Area Agency on Aging and Community Action Program, if we're not taking care of those in greatest need, then that speaks to who we are as a community and as a state.
Well, we're going to end it right there. Gary Olmd, who is the CEO of the Northwest Indiana Community Action Corporation. Thank you so much for being on.
My pleasure. Thanks for giving us a voice. We appreciate it.